So welcome everybody to our Early Childhood Studies Degree Network Sustainability Strategy Group, and this is our first roundtable. And the aim of our Sustainability Strategy Group is to promote the United Nations Sustainable Development Goals through quality early education, leading to a more sustainable planet. And we're delighted to have three presenters from the group, and they're going to be exploring a range of topics linked to sustainability this lunchtime. We have Dr. Martin Needham, who will be presenting on family hubs and sustainability. Pamela Corder, who will be discussing how sustainable is childminding. And Angela Scullen, who will explore whether there's a role for sustainability leads in practice. And the format for each discussion is going to be 5 minutes presentation, followed by 5 minutes discussion between the panel members, and then followed by 5 minutes questions from the chats. And then at the end of the presentations, we'll have a few minutes for any further questions or reflections, and also any thoughts about new topics areas linked to sustainability that people might like to explore next. Just a reminder, whilst presenters are presenting, please have your microphone on mute. And if you have any questions or reflections during the sessions, please pop those into the chat. And as we said, this session has been recorded. Okay, so without further ado, I'd like to introduce to you Dr. Martin Needham, who's a reader in early education in the School of Education at Manchester Metropolitan University. Martin trained and worked as an early years and primary school teacher, working in Nottinghamshire, London, and Pakistan. This was followed by development roles in education management and leadership in Pakistan, and then with early education, extended school services and children's centre provision in England. Martin's been a senior lecturer since 2003. He's taught on education, early education, and multi-agency working in the early years at undergrad and postgraduate levels. Martin's published work on multi-agency working, young children's learning, professionals engaging with parents and leadership in the early years, as well as research projects which have been funded by the Football League, Department for Education, World Bank, and NHS Scotland. He's recently been involved with early education policies, exploring early learning and workforce development, both in the UK and internationally, publishing on school readiness, multilingualism, and sustainability in the early years. And I shall pass over to Martin now. Thank you.
Thank you, Sandra. Hopefully you can hear me okay and see the slides. I can see some nods, so that's all good. I will crack on because there's only 5 minutes to get through this. Just as a bit of context, I'm going to talk about family hubs, but I see this as fitting into the established practice of children's centres and what was at one point Every Child Matters. Those initiatives were established in the 2000s, and children's centres were established as supposedly universal access opportunities for parents and children, particularly in disadvantaged areas, but they weren't limited to parents from disadvantaged backgrounds. They were offered as universal services, and Every Child Matters was an initiative intended to encompass all children from 0 to 18, and to look at their well-being and welfare as part of their educational experience, but broadening out from that with not just a solely an education focus in schools. In the period from 2010 to the present, funding had dropped away from those services. They'd often been cut back, pruned, reduced down, focused on particularly disadvantaged or troubled families in that period of time. But then the post-COVID, the spiraling numbers of children with special needs and families in challenging circumstances, concerns about children's language development have really underlined the benefits of doing activities that are supporting children from an early age and supporting families as a whole. Similarly, the problems with special needs and the numbers of children being identified with special needs, not just in the early years, but across the age groups, has led to the new Labour government, the government that is new, that is Labour, pushing forward family hubs as a policy. So family hubs were established between 2010 and 2024, but that policy has been extended. And it's looking to join up services, not just for 0 to 5s, but it's looking to support families that might be in difficulties across the age phases. And I wanted to sort of think about the importance of sustainability here for families. The family hubs present the opportunity to address long-term social and emotional needs, so that there's direct support for children, but the families supporting those children, potentially not just in the early years, but also through key stage 1, 2, 3, and 4. And we've seen increasing numbers of schools that are offering support for well-being through NHS advisors being based in schools, support workers that are based in primary and secondary schools to support additional needs, particularly around emotional well-being. So potentially it's got family hubs policies could reduce the number of looked after children by preventing them being taken into care if parenting support's offered early. It might reduce the number of children then experiencing the problems that are often associated with looked after children. It can reduce isolation and othering that parents and their children might feel. And it can offer early support for learning needs that can prevent children from being excluded from school, disadvantaged through the education process. So like that addresses a number of the SDGs in terms of equality of access, challenging some of issues of poverty. I see some of the problems, the challenges in terms of sustaining a workforce alongside that is the affordability of doing that. And sort of to try and balance the books, it seems like the family hubs policy may be spreading out a workforce that's already been thinned out from the situation it was in the 2000s, and asking them to work across not just with the families between 0 to 5, but then maybe continue to support families as those children progress through into primary school. I can see the benefits of that, but that also maybe places additional emotional challenge on it, may reduce the capacity of those services to support children under 5 because they're covering a wider age range, and it might mean that that support is diluted. I've been the chair of an advisory board for a children's centre for the last 10 years that's very close to the university here in Manchester. I attended a children's centre meeting last week, and I was asking them about what the impact of family hub policy might be, and they're still not clear what the ask of family hubs will be. I suppose other concerns would be that if it's a multi-age hub, that turning up at the centre that's allocated as a multi-age hub might be stigmatising. It might tend to focus on the older children that are often perceived as having their needs being a priority. That the staff might be spread too thinly. And that only high priority families will be supported. And also that if health becomes a focus rather than education, that might favour medical models being applied. So if possible, I think it would be important to sustain provision and staffing that locations might be better placed in educational settings rather than health settings. That multidisciplinary staff are important to services being effective. That means making sufficient space in bases to allow that. It's really important to pay attention to families' voices. If they feel a location is not suitable or they're worried about attending it, we should listen to that. That we do need to work on the transitions between settings. And joining things together will be really helpful. The continuity of relationships could be really helpful, and I sort of welcome the Family Hubs initiative in that way, but there are definitely problems that need to be solved, I think, as part of this process. And if it can be kept as a broad offer as possible, I think that has benefits, that you potentially make services less stigmatizing and more beneficial because of the balance of role models that you get in a universal service. Okay, that's sorry if I've strayed over my time a little bit, but hopefully not too much. And apologies for my croaky voice today.
Martin, thank you very much. It's a really interesting topic, something very dear to my heart, having worked in a maintained nursery school which was integrated with the children's centre a few years ago. So just so that we keep to time, we've got 5 minutes now to discuss as a panel. I'm going to put my alarm on, so a little noise will go off in 5 minutes. Okay, right, so who would like to start us off?
So I'm going to play devil's advocate. Do we think the old, if you think of the children's centres and the family hubs, do we think they did work well? Certainly, and this is linking on something Sandra's just said, certainly when you were to compare what support was given to early years settings in schools. And that's just me being a devil's advocate there. What do we think?
So are you saying, Kerry, are you questioning that there wasn't necessarily an equality of support?
Yeah, I mean, look at what Martin's put on his PowerPoint. It's like recommendations, and it was about the transitions and that type of thing. Where I worked, it was very much that there was a children's centre because it was an area of deprivation in the city, and I was working in a nursery linked to a school, and we had very little financial support, that type of thing. We had a children's centre, which was ironically built on top of our old nursery when we moved, and I knew someone who worked there who couldn't spend the money. They had almost too much money to spend. So I'm just playing devil's advocate now, as do we think it really worked together, and what could we potentially do if they all do come back, as we hope that there will be support? How do we think we kind of reduce the inequality?
Go ahead, Pamela.
Well, I was just trying to clarify the question, because I'm still confused about the government's policies and how it intends to link sort of existing children's centres with family hubs. And do family hubs have children's centres incorporated? I still don't understand whether family centres provide sort of services for children, young children. Do they, or do they work alongside?
The situation that we have here in Manchester is that the number of children's centres reduced, but children's centres still exist. There being the family hubs policy is churning at the moment in terms of Greater Manchester as an authority area. The settings will be asked to put out new tenders to continue children's centre work as family hubs during the course of this year, but it's still not the kind of detail you're asking about is still not clear. So it's definitely a time to consider the detail and work things through. I worked as an early education officer. Back in 2000, I was working for a local authority as an early years officer, working with an early years childcare development partnership. We had a number of children's centres and neighbourhood nurseries. We tried to join those up effectively with schools, so we worked hard on the relationships between the children's centres and the schools that they're supporting, and hopefully the children's centre activities might overlap in the school. So if they're putting on a stay and play session with creches to support those, they would be located in schools. That's the situation that we have here in Manchester with the children's centre I work with. They stay and play sessions are often and parenting courses are often put on at the nursery, which is the heart of the children's centre, but equally they're put on in public spaces around what is now a much bigger catchment area than it originally had. They at the moment they don't have to focus on exclusively on disadvantaged families. They're still able to focus on it as a universal offer still. But I can see if it's rolled out as a wider policy, that might become more difficult to maintain. I mean, I do remembering back to evaluations of children's centre programmes, the concern was that it was middle class families that was making the most of courses and parenting classes, and the hard to reach groups were the ones that were disadvantaged in the process. I think that's the challenge. I think that's the challenge of this area of work, is sustaining a balance between who's accessing it and participating. I don't think there's an easy, straightforward answer. I think it's really important for local communities to be involved in discussing how it works best in their area.
Martin, thank you ever so much. It's a really interesting discussion, and I think we could probably spend the next 30 minutes talking about it. Actually, I've got lots of questions and comments, but we're going to move on just because of our time, and we've now got our next presentation, and we'd like to invite Pamela Calder, who's the Honorary President of the Early Childhood Studies Degree Network and Honorary Visiting Research Fellow at London South Bank University. Pamela is also a chartered psychologist, And her research and campaigning for over 50 years has been concerned with establishing a sustainable system of early education and childcare that works for women's rights, for children, for its workforce, and for the wider society. And she's consistently argued for better education and training for those working with the youngest children, including babies, and was instrumental in the creation of the Early Childhood Studies degree network and the first set of QAA subject benchmark statements for early childhood studies degrees. Pamela continues to research and publish and is a regular participant in the Early Childhood Studies degree network research conferences and in the conferences of ESERA, the European Early Childhood Education Research Association, and we'll be discussing about sustainability and childminding. And over to Pamela.
Thanks very much, Sandra. And let me go to my slides, if I can. So, which I haven't managed. Let me see if this works. Can you see it? No.
Yes, we can.
Yes, Pamela, we can see
right.
it.
Okay.
Yeah.
So yes, moving on from that introduction, I went to the ESERA conference last year and saw that there was a seminar called Recognising Home-Based Childcare as a Valid Option, a Global Matter of Concern. And I had worries about this. And going back historically to 50 years ago and to the feminist demands about women's liberation, I wasn't sure that childminding could ever fit into this and work properly. So let me see if I can set the slideshow going. So the seminar covered 3 papers. One was looking at attempts to use a measure that had been used for nurseries to be used in home-based care as a measure of quality. The other was looking at home-based childcare across 6 countries, where a lot of people argued that childminding, home-based care was a good solution and had been not given the attention it deserved. And the last one by Glenda Walsh and Lynn Ang, once again looking at a review of what we know about childminding and trying to look at it in terms of experiences and outcomes. But I remembered my structure probably is going to be looking at that seminar, the Women's Lib Demands, and the Sunningdale Conference. Now, the women's liberation movement demanded free universal 24-hour nurseries, equal pay, equal education and job opportunities, free contraception and abortion on demand. All issues, I would say, that are still controversial and we haven't actually reached where we wanted to be. But in the 1970s, the movement was powerful and individuals were meeting, setting up their own nurseries, campaigning in colleges, campaigning in workplaces and getting nurseries established with a vision that there would be universal, state-funded, universal care that was going to be similar to a school system, in that one can assume that everybody had access to it, everybody had a right to it, and that it would work for mothers who wanted to carry on in work and carry on and getting their children looked after well at the same time. This meant that there was pressure on government to expand, because play groups were being expanded as well, because people were taking it into their own hands to try and find ways of getting their children looked after while they still went to work. And the government responded to this by setting up a conference in Northern Ireland with the Department of Health and Social Security and the Department of Education and Science, but came to very disappointing conclusions from our point of view, which was that childminding and voluntary provision was what they should go for. David Owen, giving his foreword, said, "We want to do what is attainable, not what is desirable." And what they thought was attainable was supporting childminding on the grounds that it could provide attachment and one-to-one care between the childminder and the child. And this view was also supported by other people who then had a longer history in influencing views in this country. Lady Plowden was there, the author of the Plowden Report. Mia Kilmer Pringle was there, who became the founder of the National Children's Bureau. And they too were pushing for these voluntary solutions and private solutions, rather than what the Women's Lib movement have been arguing for, which were state solutions and universal solutions. And the context at the time was that attachment was very important, and it was still seen as mother or mother substitute. And even though Michael Rutter had already published his book in 1972, saying that children could have multiple attachments, that stability was important, but there were other ways of providing it rather than it being just with an individual. And it's those structural sustainability issues about childminding, which I think are still there, that led me to be unhappy about focusing so much academic attention on trying to investigate the quality of childminding. Because I think it can never be a universal solution when it's based on individual, usually women, deciding to offer childminding in their own homes, and where it's susceptible to them deciding not to, that there's a family crisis and they have to close it down, or what happens when they're ill and there is no backup. So there's insecurity for the parents using it and insecurity for the children using it. If what is supposed to be a stable relationship then breaks down. There are other problems about the attitudes of the people who are providing the childminding. The assumption is there's going to be this loving relationship, but that may not be so. And how, going back to the bottom one there, how do we assure quality? And the other problem is the problem for the workforce themselves, sort of workforce precarity. And that's the long-term and lifetime effects it may have to be a childminder as a self-employed person. You don't have access to sick pay, to paid holiday pay, and you probably don't have, well, you certainly don't have any employer's contribution to a pension. Any pension you have to arrange for yourself. And you're probably low paid. And that, again, is going to have a lifetime effect on you. And the fourth one about lack of assurance of quality, that's really where things perhaps have changed, that initially in the 70s, it was very much luck whether you got a childminder that would look after your child and that your child enjoyed being there. So the next attempt for those who actually thought childminding was a good solution was to try and get more government support and things like childminders, the Childminding Association, which is now PACEY, set itself up in 1977 to try and get support from the government to keep childminding going, and also to say that it could be a good solution for parents. And then looking at how it changed over the years in terms of the registration that and regulations that affected them, so that it became under Ofsted in the 2000s. So this was another attempt to guarantee quality. And now we've got the recent changes by the current government, which it's allowing childminders to work from non-domestic premises, which raises another issue entirely about how we're seeing childminding. Now, these attempts to improve quality, the early years foundation stage being introduced in 2008, and all early years providers having to provide it if they want access to the funded hours. So that now, if you're a childminder, you have to choose to be on one of the registers. You have to be on either the early years register if you want to provide for young children and babies. And you probably have to have a qualification at level 3. You also have to go and have your house checked so that you can be sure that you can provide safety. You have to be able to show that you can respond to children's illness. So you have a number of hurdles to meet, all intended to improve an assurance of quality. But it seems to have led over the last 10 years, and increasingly just over the last couple of years, with a rapid decline in the number of childminders. So 1,250 fewer since 2024, and 25,300 in the country since March 2025. We're waiting for the most recent update, I think, to know how many we've got now. But anything like the Early Years Alliance, CORE and PACEY are all giving their reasons as to why they think the decline has happened.
Pamela, sorry.
Time to finish?
Yeah, just 1 minute.
Well, I'm almost there, because what I want to argue is that it's the wrong route anyway, that childminding can't supply what we need to meet Sustainable Development Goals for quality early childhood development, equity, gender equality, and decent work. And that's for all the people involved, for the childminders who provide it, for the children who experience it, for the parents who want their children to be be brought up alongside them in cooperation with themselves. And there's a wider problem of equity amongst the professionalism of the staff, that whether or not you can ever have professional equity, if you like, between childminders and those working in nurseries. And certainly it's no longer going to be a low-cost solution. And this led me to think, in a way that I haven't got time to explore, about the whole neoliberal framework that we're working in, that was not there in the 70s, that came in from the 80s, and has changed the way in which we think about what's possible. And I think we're still dealing with that. So I'll stop there.
Pamela, thank you so much, and so interesting that historical perspective on childminding. Martin's got his hand up.
If I can sort of take the Kerry role in this one, we included childminders as part of the study of the impact of early years foundation status and training, and my children are grown up now, but both of them spent time with childminders. Just the quality of provision I wanted to come back on, because I think childminders can really provide high quality relationship support. You know who you're getting with a childminder. You know, if your child's in a setting, how do you know which practitioner it is that's going to be supporting your child? I think if the quality systems are put in place to support childminders, they can provide high quality care, and I think they can be consistent in what they do. If they weren't consistent, you know, like, it's very clear where the buck stops with a childminder. I do agree that the sustainability issues with regard to fair remuneration for the work are a big issue, and I share that sort of very broad sustainability concern that that 1976 turning point. I think it's really interesting that you've highlighted that when you're quoting David Owen as saying it's not the most desirable, but it's the one it's the one that we can afford to do. And I think it's really sad that still seems to be the situation, that similarly to the family hubs, why are we fighting for funds to do these activities when other countries put far more investment per child into their systems? So for me, that's the big sustainability question in this area.
Well, for me, the one is availability, that you're never going to be able, I don't think, to have a private system where you know you can get a childminder which works for you and your children. And I don't know how you know in advance whether the childminding is going to work. You know, when you say you know the person, well, you're assuming that our quality guarantees now about having certain level of qualifications and things do guarantee that. Maybe. But the bigger problem for me is you couldn't universalize it because you won't get enough childminders, and you've got childcare deserts.
I agree with that, but I do think people in communities know who's an effective know who's a good childminder, and I think it's really important for childminders to establish themselves and develop good reputations, and when they do, I think they can be very effective.
Do you think people want to be professional in that way, that they want to do it for the rest of their lives, or only do it when they've got their own children, which used to
no, I've definitely encountered childminders that are very they're part of networks, they work together with other childminders, they are very keen to undertake training and develop themselves as professionals, and very keen to be seen as treated with respect as other professionals in the field are.
If we wanted graduate workforce.
Sorry, are we going to have to leave it there? It's a really interesting debate, and I'm really interested in those two perspectives. So time has gotten away with us, and it's time to move on to our last presentation, which is from Dr. Angela Scollin, who's an Associate Professor in Early Childhood Studies at Middlesex University, leading scholarly work in children's rights and self-determination. Oops, sorry. And in children's rights and self-determination, facilitation, reflective professional development, enabling environments, ethical research with and for young children, and sustainable pedagogy. Angela is currently teaching and researching sustainability in early childhood. She's the co-vice chair for this group. Her philosophy focuses on the child first, which transpires from her practice and doctoral research, as well as from several publications where children's self-determination is approached as a resource for children, as well as for adults learning. And she's currently collaborating on the following reviews for the UK Quality Code Advice and Guidance Review, supporting children to achieve their potential, and the Birth to 5 Matters non-statutory guidance for the early years foundation stage. And over to Angela.
Thanks, Sandra. Thanks very much. And thanks, Martin and Pam, for really interesting insights into the topics presented. And I think there's going to be so many overlaps. So just for time, I'll get going. So I decided to have a look for this presentation. Is there a role for sustainability leads in early childhood education and care? So obviously there is, because we're told by the government and by the DfE that there's a guidance for us to be engaging with called the Sustainability Leadership and Climate Action Plan, which came upon us in 2023 and has been revised along the way up until, I think, 25 it was revised. So the idea is that there's going to be a sustainability lead by December 2025 in educational settings. So we're told that the sustainability lead is something that we really need to be advocating and moving towards, because we want to be focusing on sustainability. So I thought to myself, oh, I've got 5 minutes to cover this in a session on the Roundtable. How can I fit everything all in? So I decided to have a look at the guidance, which was quite interesting. And I decided then to talk to and have conversations and reflections with 21st century practitioners, leaders, managers, directors of early years settings, and a range. I might cover childminders, and I really resonated with the points that Pam and Martin were talking about, how contextualised and professionalised the childminders were viewing themselves and presenting themselves and advocating for themselves. So I'll park that for now, but I wanted to join in on that conversation. But it's interesting to think that the settings would have been told that they need to have a sustainable lead in their setting by December 2025. So when I went out to speak to directors, managers and leaders, it became quite apparent that there was a real variety of reactions to having a sustainable lead in the setting. So I'll just give you a really quick overview of what came up. So first of all, what came up was, have we always had the concept of sustainability in early childhood? Is it new to us? Haven't we always been sustainable? But isn't it being rebranded and called something else because of government agenda? So that was something that came out that was really a great conversation. And it also came out that, sustainability is an entangled and fluid and very dimensional concept. And it means different things to different sectors, different disciplines, very temporal at different times. So I thought to myself, oh my goodness, how am I going to present this? So this picture here, I've left it on there, is Pandora's box, because this is what has happened when I've gone in to talk to those in practice working with the concept of sustainability on many dimensions and levels. So we opened the Pandora's box, and I think I've probably got maybe 3 minutes left to go through the box. But what came up is, what do we mean? Are we being sustainable in practice or for practice? Are we being sustainable realistically? Are we thinking about the workforce, families, children? Are we thinking of survival for humans? Are we thinking of survival for provision, as Pam and Martin have just, eloquently shared with us? So there was lots of conversation started, and one of the people that I spoke to, she used the term, "I'm trying to stay afloat." She's trying to keep her provision afloat. I said, "Oh, that's great. That links to the sustainability goals on land, in the sea." So we had a bit of fun with that, but it was a bit kind of yeah, it was a very deep conversation. And what came up were many issues regarding recruitment, regarding the quality of the practitioners and the workforce that were coming in. And she said, well, what came up from a few people was that, yes, we have got sustainability leads, or no, we haven't, because we've got other fish to fry. So very quickly, I think I've got probably 30 seconds for each of my slides. So sustainability leadership and climate action plans are being proposed by the DFE, that all settings are making sure that they've got really strong climate plans in their settings, so that the environment, the climate, and biodiversity are all addressed and covered. But what came up from that was practitioners that I was speaking to, they said, well, this is their voices. I've captured some of them. This is just a very small glimpse. I do have staff who are ready to take on the sustainability lead role. Of course I do. There are too many other daily distractions to deal with, though. And they take priority, such as staff leading baby rooms, or staff, covering routines, or actually having enough people in to cover ratios. It's really complex to keep everything going to point and to keep the plate spinning. Yes, said another professional that I spoke to from early years, yes, we have a placement student with us at the moment who's also employed, and she is leading our drive on sustainability and the SDGs, and she's actually led the staff training and using her university material and the links from her university team, and she's now leading everything that's going on there. Now, I then interviewed that student, who's going to be coming to do some work with us, and hopefully we'll be able to invite her in to do a blog. And she was able to also offer some further layers of the complexities of sustainability as to what the challenges are at bringing in training for sustainability, whilst also trying to lead at the same time. And lots of things to do with quality, motivation, resilience, well-being, and capacity and resourcing came up. So each of these bubbles has a world and a life on their own. Then another setting said that existing staff are doing a great job, but are finding it very hard to take on extra responsibilities, and some just don't want to. They're finding, space for training and taking on new concepts, quite a challenge, and it can be quite stressful. And lastly, one person said, I'm having difficulties in resourcing practitioners, let alone resourcing a sustainability lead. So I'm just going to go on to the very last slide, if that's okay, Sandra. This is one person then that I've taken a little bit further from the bubbles that we had, the reflective bubbles above, from talking to people in practice. This is really 21st century, hot off the press, just, in the last couple of weeks. One of my professionals, my colleagues that I spoke to, who's in the setting, who were talking about a sustainability lead, said, look, we are doing the sustainability lead. We've got it embedded in our practice. All my staff know about how their activities linked to sustainability. I'm feeling great with that. But when you're talking about leading sustainability, what's coming to my mind is the financial pillar. So just from the language that this professional was talking, I could tell she knew a lot about the sustainable development goals, the pillars, the different aspects of it. But she said, actually, sustainability to me means dealing with the financial pillar more than anything else. I have to pay over £50,000 agency costs because I'm not getting the quality staff that I need to come in and work in practice. So there's a staff turnover. I've got she had a core team who were very kind of robust, been there a long time, but because her provision was growing, she needed more staff, and there were up to maybe 10 vacancies. And what was happening is she was recruiting, but the recruiting with integrity was a huge area for her because she's got very high quality setting. She was getting applicants coming in who didn't know what the EYFS was fully, didn't know the characteristics of learning, and found it very tricky to talk about the EYFS to the depth that she would require and the philosophy with it. And then just lastly, she talked about sustainability, saying, when I do get the right applicant, the onboarding is so challenging. So the time that I need to get somebody in, to get DBS references and induction and training, so the full of philosophy of the setting and the quality that I need is in place, are really time challenging. So that's in a nutshell, and that's just, if I just say that was like a dot after the sentence of data, and it wasn't even, it's not really data really, it's reflective dialogues and conversations with professionals about sustainability leads and what the reactions about, you know, having this in practice means for our students, our practice, our provision, our quality, and all the things that Martin and Pam were talking about, you know, what's attainable, what's desirable, and what's actually happening. So I'll just call it a day there.
Angela, thank you so much. That's really interesting, and also getting those opinions from people who are just sort of starting out in those roles and those thoughts. And as you say, lots to do in terms of research. We've come to the end of our time, and I was we're going to hand over to Kerry in a minute to sort of close and for further comments. But I think there's been some really interesting themes which have gone across all three of our amazing presentations around resourcing, funding, quality. And I think we've only just scratched the surface of all of these discussions, and it would be lovely to have a longer time to explore these. But thank you very much to all three of you. It's been really interesting. And over to Kerry.
Thanks, Sandra, and thank you to you for chairing. And also I'd like to say thank you to Matt, who was hidden in the background doing all the recording and making everything look amazing. Just to say to people who are accessing this recording that basically we see this as the first of many. And as you can see from the conversations, it's all about looking at the reality. So we know the theory, we know what we read in policies, we know what we are often asked and told that we need to do from people on high. But the idea of these conversations is to bring it back to reality and hopefully support one another and grow a network of people interested in all things sustainable. So please access the website as much as you can. And also contact us with any ideas of what you would like to hear in the future, or any suggestions, or if you'd like to join us for conversations yourself. So thank you very much for attending, and hopefully we'll see you soon.